More than 100 EMS agencies across Maine are facing a major change in how they access critical medications. MaineHealth and Northern Light Health are ending long-standing agreements that supplied controlled substances to EMS crews. The hospitals say it's all due to a new Drug Enforcement Agency policy. As News Center Maine's Drew Peters shows us, local departments say they'll have to shoulder the cost and the responsibility themselves.
We have fentanyl, which we use for pain management.
These little vials are what help Leamington Fire and EMS Deputy Chief Corin Meehan and his team save lives.
Whether it's a mental health emergency or traumatic injury that's producing that.
Moving forward, though, they're going to cost him a whole lot more.
A significant financial impact that we have not budgeted for.
That's because MaineHealth, which normally supplies the department with controlled medications, is ending its contract with them and around 90 other EMS providers in order to align with a newly implemented DEA law. A MaineHealth representative writing in part, after extensive review of the law, regulations, and guidance, MaineHealth and other healthcare systems have concluded that the requirement for EMS agencies to obtain and manage controlled substances under their own DEA registration is not optional.
That was quite a surprise to us, obviously, because we had been previously told that nothing would change.
A surprise that Meehan says comes with a nearly $30,000 price tag to buy the proper storage for the medication, which doesn't include the cost of having to purchase his own vials in bulk, or the time it will take for crews to log each time one is used.
Going forward, we're probably going to have to increase that and start stocking extra medications on the ambulances so that way we're not out of service after transferring care at the hospital.
Staff with Northern Light Health say they're also ending their medication supply contracts with around 50 EMS providers due to the new policy. But in a statement from DEA New England, representatives argue the change simply gives EMS agencies another option to ensure their medication is properly handled. Writing in part, EMS agencies can still operate under the direction and DEA registration of a medical director or a hospital for purchasing needed controlled substances. The contracts remain terminated, and Windham Fire Chief Brent Libby says his department is still having to spend around $30,000 to get the needed medication.
It'll probably take us a good year or two to actually level out and make sure that we're covering everything that we need.
And while his municipality has a bigger budget to help support the expenses, he says others like Meehan's may not be so lucky. Drew Peters, News Center, Maine.
Now, representatives from MaineHealth, Northern Light Health, and the DEA New England say their staff are dedicated to helping EMS providers navigate this registration process. The deadlines for the providers to come into compliance with the new policy is July 14th.